One of the things that makes being a physician so rewarding is actually using your clinical skills. And in those moments where you diagnose something and you did not have to do a test, or you did a test to confirm, but you diagnosed and treated it before, those are the moments where it's like, strep throat is probably one of the most overtreated diagnoses, at least here in America. Strep throat is a clinical diagnosis. So a kid comes in with a fever, headache, may or may not have a sore throat actually, may have abdominal pain, may have nausea or vomiting, may have a rash, and their throat looks like this. That is strep throat. We have lots of kids who test positive for strep throat who don't actually have disease-causing strep. And let me explain why that is. So when we do a group A strep test on you, this throat swab that we do on you is a clinical sample. So it tests for the presence of group A strep, yes or no. Now, in research testing, they can actually differentiate between the subtypes of group A strep. That means that if you are someone who is a carrier of group A strep, but a carrier of a strain that does not actually cause illness, when you get tested at a doctor's office, it may be positive, even if strep is not what is actually making you sick. So we see this frequently in pediatrics where a kid will come in with respiratory symptoms. So cough, runny nose, congestion, or other symptoms like diarrhea, and gets tested for strep because maybe they have a fever also, or they have a sore throat also. And if any of you have ever had a cold, you know you're gonna get a little bit of that throat itch also. But kids are not so good at explaining the difference between pain or itchy or dryness in the throat. So get tested for strep and it ends up being positive. So I always take the time to explain to families, look, your kid clinically does not have strep throat. Their strep test is positive. They are very likely a carrier, and up to 40% of children in the United States are carriers of strep bacteria. So how do you know if your kid is a carrier or not? Very simple. Get them checked when they are no longer having symptoms. So a child who is positive for strep throat while having zero symptoms at all does not have disease-causing strep. That means your kid is a carrier. And there are actually antibiotic regimens to help clear carrier status, but it is not the same as active disease-causing strep throat. So in this era of antibiotic resistance, we should be doing a better job of clinically guiding our management for kids and not relying just on testing.